I'm Gus Kelly, and I'm presenting on Lyme disease. The infectious agent for Lyme disease is a bacterium called Borrelia burgdorferi in North America and Europe. Um, Spiral-shaped bacteria. They have a spiral shape. It's an obligate parasite, so it can't survive in an environment outside of a host, and it can change its surface proteins to avoid detection by T cells and antibodies. Some history of Lyme disease. The term was coined in the 70s to describe a kind of joint arthritis identified in some kids in Lyme, Connecticut. So it's pretty recent. It was identified by a group of researchers led by Dr. Alan Steer, and in 1981 the bacterium was identified. Incidence and prevalence of Lyme disease, mostly in Europe and the U.S. In the U.S., it's mostly in these northeastern states and the Great Lakes area. We'll talk more about that later. Over 89,000 cases in the U.S. reported to the CDC in 2023, the most ever. So it's growing. Estimated almost 15% of the global population has been infected with Lyme disease at some point. 200,000 cases annually in Europe. And in these areas in the U.S. and northeastern states and the Great Lakes states, areas where there are a lot of mice and deer who allow ticks to transmit this to humans, endemic in northeastern U.S. and the Great Lakes area. And about 95% of cases in the U.S. occur in just 10 states, which are among these here. So as you can see, it's becoming more prevalent. Back from 2000 to the purple block on the right is 2023. Most cases reported ever. Morbidity and mortality. Morbidity, it's one of the more common vector-borne diseases. Almost 500,000 people are diagnosed with Lyme disease in North America yearly. Mortality, death directly from Lyme disease is pretty rare. So death rates are extremely low, but if death does occur while you have Lyme disease, it's usually due to a complication of Lyme disease. At-risk populations include people who live in the states I mentioned, northeastern U.S., the Great Lakes area, and people who are also outside a lot because they get more ticks. Transmission of Lyme disease. It's vector transmission. It's spread to people by black-legged ticks. There are different stages to tick life. There's a larva, nymph, and adult, and the larvae and nymphs are most responsible for transmission of Lyme disease because they're smaller and so they're harder to identify in yourself, and they feed in the late spring and early summer, which is when people are outside more, and the adults are obviously easier to identify, and they feed in the winter and the fall. Ticks need to be attached for more than 24 hours to transmit the bacteria that causes Lyme disease. So yeah, usually people get it from the spring to the fall. That's also another. The symptoms are similar to the flu. So if you have like flu symptoms in the summer and you don't have a runny nose and cough, then maybe you have Lyme disease. Another way it can be transmitted is if it's untreated during pregnancy, then it can, rarely, but it can spread from the mother to the child. From reservoirs of Lyme disease, rodents, particularly field mice, pass bacteria to ticks, who in turn pass it to us. Birds are also reservoirs. Dogs and cats can get Lyme disease. Deer are not reservoirs, but they're good hosts for ticks. So where there's a lot of deer, there's a lot of ticks, and where there's deer, a lot of rodents, and ticks, then those are the areas where you get a lot of Lyme disease, particularly black-legged ticks. Signs and symptoms of Lyme disease, as I mentioned early, the symptoms are very flu-like, just without the runny nose and the cough, fever, chills, headache, fatigue, muscle and joint aches, swollen lymph nodes, very like general viral symptoms, which is why it can be kind of hard to diagnose. Um, Later on, facial palsy, heart palpitations, inflammation of the brain and spinal cord when the bacteria gets into your nervous system and starts to cause more damage. Because there's also a sign of Lyme disease that's pretty unique. It's called the erythema migrans rash, also called the bullseye rash. It's this rash that occurs usually at the site of infection, with like a red circle and then a bigger red circle around it. It looks like a target, and that occurs in about 70 to 80% of people who get Lyme disease. So not even everybody. Diagnosis can be tricky to diagnose. Uh, Signs are better than symptoms because the symptoms are so general and apply to a lot of other diseases. Um, the general symptoms is often why diagnosis can be delayed, um, and why you should. It's good to notice if you have that bullseye rash because that's really a telltale sign. Blood antibody tests are the way that you test for Lyme disease, but these tests obviously don't measure the actual infection; they measure your body's response to the infection. So because of that, false negatives can occur because you can have in the early stages of Lyme disease, you can have Lyme disease and it could be affecting you, but your body hasn't responded to it in a big way. Um, so those antibodies won't show up on the test, and then positive antibody tests can result uh, after your body has resolved the infection. Those antibodies are just still around. Doctors will use what's called the Western blot test to confirm if you actually have Lyme, which gives more information about the antibodies and like what bacteria they're fighting. Treatment for Lyme disease. This bacteria is very sensitive to antibiotics, thankfully. So usually oral doxycycline for 3 to 4 weeks is the typical treatment. And then amoxicillin for kids because doxycycline can lead to some side effects. Uh, there's no vaccine currently, but there's a lot of research in that area, and there has been, I mean, some vaccines that have provided some protection. They're just not FDA approved. There are different stages to Lyme disease, and struggles with diagnosis are a big part of why people experience more in the early stage. There's a common myth that if you have Lyme disease, you just always have it. That's not actually the case. The vast majority of people complete antibiotics and return to normal health. But there are people who have prolonged symptoms, and sometimes the prolonged symptoms resolve on their own within 6 months of completing treatment. For instance, the or nervous system damage, neurological damage, generally resolves slower. But even outside of that, there's a subgroup who still has symptoms called post-treatment Lyme disease syndrome, and this is a big area of research because researchers aren't really sure why this happens. Some ways to prevent Lyme disease. Checking for ticks is key, particularly in the armpits, behind knees and hair, and in the groin. Because even if they've bitten you, it doesn't mean they've infected you, because they have to bite you and then be there for 24 to 48 hours to actually transmit the bacteria. Tick removal. A lot of people say you have to like burn or twist off a tick. You're really just supposed to grab it as close to your skin as possible and then just pull it out. Showering as soon as possible after being outdoors is a big way to reduce ticks because they just haven't latched onto you yet, so they'll wash off with the water. Tumble dry your clothes on high heat can kill the ticks. Wearing pants and long sleeves can reduce ticks. Obviously, using bug spray. The CDC recommends using DEET because it's just more effective, and avoiding tall grass when outside is important for avoiding Lyme disease. So some other tick-borne diseases um, that can be carried by ticks. Rocky Mountain spotted fever, that's the worst one that I noticed. More severe, can lead to organ failure, shock, and death. Also carried by the black-legged tick. Anaplasmosis, very similar symptoms to Lyme disease, transmitted by black-legged tick. Ehrlichiosis, uh, usually transmitted by the lone star tick, but sometimes the black-legged tick also. So when you have Lyme disease, um, it's important to check for other tick-borne diseases because black-legged ticks can carry other diseases as well.